Hi, I'm Tracy MacNeal and welcome to Ximedica. This is a webinar series and today we're going to be talking about some key tips for startups and investors in the medtech and diagnostic space. I am the president of Ximedica DX. I've spent over 20 years helping companies grow and we're looking forward to spending a little bit of time with you today.
And hi, I'm Najib. I'm Vice President of Business Development at Ximedica. I have over 15 years of experience in molecular, in sales, marketing, and global commercialization with Siemens, Abbott, Roche, and just recently Cepheid.
So today we're going to be talking about some things we know you know some things about. We know this is a seasoned audience. You know that it's important to make sure you've got a successful investment. And we're going to share some stories with you to make you think a little more deeply and maybe from a different perspective than you normally would. Developing your technology for a specific market may seem like an obvious thing. Performing an effective market assessment is probably something you feel like you've already done. But we're going to share a few stories that you may not have had access to before to help you think a little more deeply about it.
Okay, so let's get started. When we go to launch in technology, we all start in the same place. So the first question is, what market segment are you focusing on? So you want to quickly identify a market segment that is the right fit for your technology, that has a strong clinical application, and that allows you to make an immediate impact upon launch. So now let's try and quantify this. So let's take a look at what was the financial vitality of this market segment. So for this example, we use the molecular diagnostics industry. And as you can see, by the year 2020, it's expected to be an $8 billion market and grow to a $10 billion market by the year 2021. But when we take a look at this, is this sufficient information in order to ensure a successful launch? So as Tracy and I know all too well, 80% of businesses fail and only 20% of new businesses actually survive past their first year.
Right, and that's of the companies that get funded, right? So part of what we're trying to bring to your attention today is that many great technologies don't get funded because they haven't really thought things through well enough, and of those, only 1 in 5 actually succeed. So there's some really important topics here.
Yeah, so let's take a look at a real-life case study. This is 4 companies that wanted to penetrate the global influenza diagnostic market. So they all started with market assessment that looked at, in 2015, $1.9 billion was the anticipated market, and it was expected to grow at a rate of over 6.4% up to the year 2024. So what's interesting is 2 of the companies had a less than desirable commercial launch, but of the other 2 companies, one actually got bought by $5.3 billion, and the other one is still growing at 57%. So what did these companies do differently? So not only did they look at the molecular market, they also analyzed what was the fastest growing sector of the molecular market. And they saw that the molecular point of care market was growing at 13%. They took it a step farther and really tried to understand who the customer would be that's actually buying their product. So these 3 companies identified physician office labs, physician offices, and emergency rooms as the customers that would actually be buying their product. They took it one step further and said, how will the customer purchase our product, and what is the value payers assign to the clinical application of our product? So in general, the companies that had a sub-average commercial launch decided to launch into the current market. But the 2 companies that had immediate success recognized the shift in the market to the point of care, understood why the shift was happening in healthcare, and decided to pursue the market that was in motion.
I love that story. It's sad to think that companies could spend 3 to 5 years, sometimes longer, developing products to launch into a market that's disappeared by the time they get there. Right?
Yeah.
I also want to point out, so that we're not going to go through all of these issues. We want you to think about these issues, but I want to jump down to reimbursement and pricing. So I want to share a story about colleagues of ours in the market called Exosome Diagnostics. They put out this press release on November 27th, 2017, so just a couple of weeks ago at this recording. And they have this wonderful success that they already negotiated their reimbursement rate with Medicare. And they did this because it was part of an early move that they made in their commercialization strategy to spend a little bit of money and a little bit of time up front to structure a clinical study to coordinate with the reimbursement groups so that they are going to launch with a reimbursement code. Some companies take 5 years to figure that out, and they're giving their tests away for 5 years before they get enough data to get the reimbursement. So for them, it made the difference between not just millions of dollars, but for some companies, this is the difference between surviving and not surviving. So putting thought into the pricing and reimbursement early is a really, really important thing to think about. Last, we want to tell a story about medication management. So at Ximedica, we do a lot of different types of projects. We may launch 30 projects in a year. Our first story was in diagnostics in the influenza market. And now I want to talk about an inhaler product. So there was a company called Gecko that we worked with who understood the existing market in asthma. So if you go to the next slide, Martha, there's an inhaler product. It's a standard inhaler here. But what they understood was that the device itself should be a connected device. So under that blue band, there's 30 components that help a smartphone understand when a patient, say a child or an elder, when a patient has taken their medication. So why was that important? When they did a market assessment on reimbursement, they saw that it was the payers and the pharmaceutical companies who wanted to understand the patient adherence. And so rather than spend time or skip over a fairly mature part of a market like inhalers, they said, let's make a connected device because that's where the market is going. And if you look up Gecko and Teva Pharmaceuticals and their successful exit, you'll see they did very well. So just to wrap up today, we wanted to focus on the difference for you guys, what would make it a successful investment, and things that you know, but hopefully you know a little more about now, developing your technology for a specific market, and where that market's going, making sure that when you perform an effective market assessment, you're including where the market is going, how payments are changing, how pricing is changing, so that you can formulate your strategy to win. Thank you for your time today. We're looking forward to talking with you.